High blood sugar is one of the most dangerous health conditions because it often develops silently. Millions of people walk around every day with elevated blood sugar levels without realizing the damage that is taking place inside their bodies. Long before symptoms become obvious, excess glucose begins attacking blood vessels, nerves, the kidneys, the eyes, and even the heart. Many people think that controlling blood sugar requires complicated medications or extreme diets. But after more than 30 years of treating patients with diabetes and prediabetes, one thing has become very clear. Food can be one of the most powerful medicines. The right foods can help lower blood sugar naturally, improve insulin sensitivity, reduce inflammation, and protect the body from serious complications. And some foods work surprisingly fast. Today, we're going to explore the best foods to eat to lower blood sugar, why they work, how they affect the body, and how you can use them to support healthier glucose levels. If you found this video useful, like, subscribe, and share with your family and friends. Your health may depend on it. To understand how foods lower blood sugar, it's important to understand why blood sugar rises in the first place. Whenever we eat carbohydrates, they are broken down into glucose. Glucose enters the bloodstream and becomes the body's primary source of energy. The pancreas responds by releasing insulin. Insulin acts like a key. It unlocks the body's cells, allowing glucose to enter and be used for energy. But problems arise when the body becomes resistant to insulin. This condition is known as insulin resistance. Instead of responding properly, the cells ignore insulin signals. As a result, sugar remains trapped in the bloodstream. The pancreas tries to compensate by producing more insulin. Over time, this constant demand can exhaust the pancreas. Blood sugar levels begin rising higher and staying elevated longer. Years later, this can progress into type 2 diabetes. Unfortunately, persistently high blood sugar affects almost every organ system. It increases the risk of heart disease, stroke, kidney failure, blindness, nerve damage, erectile dysfunction, fatty liver disease, dementia. But the encouraging news is that food choices can dramatically influence this process. One of the most powerful nutrients for controlling blood sugar is fiber. Fiber slows digestion. Instead of sugar flooding into the bloodstream all at once, glucose enters gradually. This prevents dangerous spikes. Fiber also feeds beneficial bacteria inside the gut. These microbes produce substances that improve insulin sensitivity and reduce inflammation. Patients who consume more fiber often experience lower fasting blood sugar, better A1C levels, reduced cholesterol, easier weight management. Number 1, beans. Beans are among the most underrated foods in medicine. Despite containing carbohydrates, they are rich in fiber and protein. This combination slows glucose absorption. Beans have a low glycemic index, meaning they raise blood sugar very slowly. Studies have shown that regular consumption of beans can improve blood sugar control and reduce the risk of cardiovascular disease. Excellent choices include black beans, kidney beans, pinto beans, chickpeas, lentils. Patients often fear carbohydrates. But not all carbohydrates are harmful. The quality of the carbohydrate matters more than the quantity alone. Number 2, eggs. Eggs contain almost no carbohydrates. That means they have minimal impact on blood sugar. But eggs offer another advantage. Their protein content promotes satiety. Feeling full longer helps reduce overeating and unnecessary snacking. Research suggests that consuming eggs may improve insulin sensitivity and lower inflammation. For many patients, starting the day with eggs instead of sugary cereals results in better glucose control throughout the day. Number 3, leafy greens. Leafy greens are nutritional powerhouses. spinach, kale, collard greens, Swiss chard, arugula, broccoli. These vegetables contain magnesium, potassium, vitamin K, folate, antioxidants, and most importantly, they are extremely low in carbohydrates. Magnesium plays an important role in insulin function. In fact, magnesium deficiency has been associated with insulin resistance and type 2 diabetes. Patients who increase their intake of leafy greens often experience improvements in blood sugar control over time. Number 4. Avocados. Avocados contain healthy monounsaturated fats and abundant fiber. These nutrients help slow digestion and prevent sudden rises in glucose. Healthy fats also improve satiety. Many patients notice fewer cravings after meals containing avocado. Research suggests that diets rich in monounsaturated fats may improve insulin sensitivity and support cardiovascular health. Since people with diabetes are at increased risk of heart disease, this makes avocados especially valuable. Number 5. Cinnamon. For centuries, cinnamon has been used in traditional medicine. Modern science has discovered that certain compounds inside cinnamon may improve insulin sensitivity. Some studies suggest cinnamon may help lower fasting blood sugar. However, cinnamon is not a substitute for medications. Think of it as a helpful addition rather than a miracle cure. A small amount sprinkled over oatmeal, yogurt, or smoothies can be part of a healthy diet. Number 6. Nuts. Nuts provide healthy fats, protein, magnesium, and fiber. Because they digest slowly, they help stabilize blood sugar. Excellent options include almonds, walnuts, pistachios, pecans. Studies have shown that individuals who regularly consume nuts often have lower rates of diabetes and heart disease. However, portion control remains important because nuts are calorie-dense. Number 7. Fatty fish. Fatty fish are among the healthiest foods on the planet. Examples include salmon, sardines, mackerel, tuna. These fish are rich in omega-3 fatty acids. Omega-3 fats help reduce inflammation and improve heart health. Inflammation contributes to insulin resistance. By reducing inflammation, omega-3 fatty acids may support healthier blood sugar levels. Patients with diabetes are twice as likely to develop heart disease. Protecting the heart is just as important as lowering glucose. Number 8. Apple cider vinegar. Apple cider vinegar has attracted tremendous attention. Research suggests that vinegar may slow stomach emptying and reduce blood sugar spikes after meals. However, more is not better. Large amounts can irritate the stomach and damage tooth enamel. Moderation is essential. And anyone taking insulin or blood sugar medications should consult their healthcare provider before using it regularly. Number 9. Berries. Many people believe diabetics should avoid fruit completely. That is a myth. Berries are among the healthiest fruits available. They provide fiber, vitamin C, polyphenol, powerful antioxidants. These compounds help reduce oxidative stress and inflammation. Excellent choices include blueberries, strawberries, blackberries, raspberries. Because berries contain fiber, they affect blood sugar much less dramatically than processed sweets. Number 9. Berries. Many people believe diabetics should avoid fruit completely. That is a myth. Berries are among the healthiest fruits available. They provide fiber, vitamin C, polyphenol, powerful antioxidants. These compounds help reduce oxidative stress and inflammation. Excellent choices include blueberries, strawberries, blackberries, raspberries. Because berries contain fiber, they affect blood sugar much less dramatically than processed sweets. Some foods send blood sugar soaring. These include sugary beverages, candy, white bread, pastries, highly processed cereals, French fries, potato chips, ice cream. These foods are rapidly digested. They flood the bloodstream with glucose. The pancreas must work overtime to manage the sudden surge. Repeated spikes contribute to insulin resistance and eventually diabetes. One of the most effective ways to lower blood sugar doesn't come from a bottle. It comes from movement. After meals, muscles begin using glucose for energy. Even 10 to 20 minutes of walking can significantly improve blood sugar levels. Walking acts like a natural glucose-lowering medicine. And unlike medications, it provides numerous additional benefits. Better heart health, weight control, improved mood, better sleep, reduced stress. Persistent high blood sugar can cause excessive thirst, frequent urination, blurry vision, unexplained weight loss, fatigue, slow wound healing, frequent infections, numbness in the feet. These symptoms should never be ignored. Early treatment can prevent serious complications. There is no single miracle food. No secret ingredient. No overnight cure. But over decades of caring for patients, one truth has remained consistent. The body responds remarkably well when given the right nourishment. Beans, leafy greens, eggs, fatty fish, nuts, avocados, berries. These foods work together to support healthier blood sugar levels and protect the body from long-term damage. Small choices repeated every day create powerful results. Because managing blood sugar isn't about perfection. It's about consistency. And every healthy meal is another step toward protecting your heart, your brain, your kidneys, your eyesight, and your future. Your food can either feed disease, or it can help restore health. And that choice begins with the very next meal. One of the greatest misconceptions about diabetes is that high blood sugar only becomes dangerous when symptoms appear. But the truth is, damage often starts years before a person notices anything wrong. Every time blood sugar rises excessively, glucose begins attaching itself to proteins throughout the body. This process is known as glycation. Over time, these sugar-coated proteins become harmful compounds called advanced glycation end products. These substances trigger inflammation and oxidative stress. They stiffen blood vessels. They damage nerves. They impair circulation. And slowly, silently, they accelerate aging throughout the body. The heart suffers. The kidneys suffer. The eyes suffer. Even the brain suffers. That is why controlling blood sugar is not simply about avoiding diabetes. It is about protecting every organ in the body. Many patients ask whether oatmeal is safe for people with diabetes. The answer depends on the type of oatmeal. Instant flavored oatmeal often contains added sugars and can raise blood sugar quickly. But steel-cut oats and old-fashioned oats are different. They contain beta-glucan, a special type of soluble fiber. This fiber forms a gel-like substance inside the digestive tract. As food moves through the intestines, glucose enters the bloodstream more slowly. This helps prevent sharp spikes. Patients who replace sugary breakfast cereals with plain oats often experience improvements in fasting glucose, cholesterol levels, weight management, appetite control. Adding cinnamon, berries, walnuts, or chia seeds makes oatmeal even more powerful. Not all yogurts are created equal. Many flavored yogurts contain enormous amounts of added sugar. Some contain as much sugar as dessert. But plain Greek yogurt is different. It is rich in protein and beneficial bacteria. Protein slows digestion and helps reduce hunger. Healthy bacteria inside yogurt support the gut microbiome. Scientists now recognize that gut health plays an important role in insulin sensitivity and glucose metabolism. A healthier gut often leads to healthier blood sugar levels. Adding fresh berries instead of sweetened syrups provides natural flavor without overwhelming the body with sugar. These tiny seeds may be small, but their benefits are extraordinary. Chia seeds absorb water and expand inside the digestive tract. This slows the absorption of carbohydrates and prolongs feelings of fullness. They are packed with fiber, protein, omega-3 fatty acids, magnesium. Many patients report fewer cravings and better blood sugar readings after adding chia seeds to their diets. Because they are versatile, they can easily be added to oatmeal, yogurt, smoothies, salads. Magnesium is one of the most overlooked minerals in medicine. Yet it plays a critical role in more than 300 biochemical reactions inside the body. Among its many functions, magnesium helps insulin perform its job effectively. Low magnesium levels have been associated with insulin resistance, type 2 diabetes, high blood pressure, heart disease. Excellent sources include spinach, almonds, pumpkin seeds, black beans, avocados. Sometimes improving blood sugar starts not with eliminating foods, but by correcting nutritional deficiencies. Protein is essential for blood sugar stability. Unlike refined carbohydrates, protein does not produce major glucose spikes. Protein helps preserve muscle mass. And muscle tissue acts like a sponge, absorbing glucose from the bloodstream. Excellent protein sources include eggs, fish, chicken, turkey, lentils, beans, Greek yogurt. Eating adequate protein helps reduce cravings and improve satisfaction after meals. If you found this video useful, like, subscribe, and share with your family and friends. Your health may depend on it.